Follicular lymphoma is a type of blood cancer. It affects about 14,000 people in the country every year. It's a slow-growing type of cancer, and it presents itself typically in the lymph nodes, which are these pockets of white blood cells that we have all throughout our body. Normally, the white blood cells are those cells that help you fight infection, but in this case, those cells are cancerous. And then they start to form a lump in those lymph nodes, they become larger, and then eventually that leads to symptoms and a patient's diagnosed with the disease. Common symptoms for follicular lymphoma are enlarged lymph nodes. So sometimes people are shaving or taking a shower and they notice lymph nodes under their armpits or in their neck. But sometimes people just feel more tired than average, and it's the kind of fatigue that doesn't get better after you rest. That's one common symptom. Alternatively, people can start having night sweats where they have to change their clothes in the middle of the night, or they start to lose weight without wanting to lose weight. Those are some common symptoms that people can have. But follicular lymphoma can present in a variety of other ways too. And so I think it's important that if you have a symptom that's out of the ordinary, that's not normal for you or for what you're used to, or something that doesn't get better after time, to let your doctor know. Follicular lymphoma is diagnosed with a lymph node biopsy. So some people find that they have enlarged lymph nodes on a CAT scan or on an ultrasound. And that just tells us that there's something in your anatomy that's bigger, but it doesn't tell us what's on the inside. So really the only way to diagnose follicular lymphoma is to have a biopsy. And a biopsy can be done through a needle, where a needle goes in through an enlarged lymph node or the problem in question, and then material is removed from that needle and looked at under the microscope. But the best way to diagnose follicular lymphoma is with an excisional biopsy, which basically means it's a surgical biopsy. So you might need a minor surgical procedure, taking a piece of the lymph node out in order for us to be able to analyze it. And that's important because if you have too small of a tissue, you can't run all the necessary tests to make the diagnosis, and then you end up needing to have another biopsy. So in my opinion, getting a bigger, more adequate biopsy is the best thing early on. And typically they're easy to get, and the scars are small, but it's more important to get the adequate information that we need. Treatment options for follicular lymphoma are pretty broad, and they really depend on a few things. One is the stage of the patient, so how much lymphoma there is in the body, kind of where is it distributed, for example. But the more important thing is how much of what we call tumor burden is there. So tumor burden means that the lymph nodes are of a certain size, or there are symptoms associated with that. But if you just have follicular lymphoma and the lymph nodes are quite small and they're not in very many places, sometimes people can just be observed. That means closely watching for any symptoms to develop, getting CAT scans and blood tests, and meeting with your doctor regularly. But for people that do need treatment, whose lymph nodes get above a certain size, or if they have certain symptoms, then the treatments are almost always a combination of an immunotherapy with chemotherapy. And that combination has evolved over the last few years, so we have new types of chemotherapies and new types of immunotherapies, but by and large, it's a combination of either immunotherapy by itself or together with chemotherapy. Similarly, for patients with relapsed and refractory follicular lymphoma, it depends a little bit upon whether the person needs treatment. So unlike other cancers, follicular lymphoma can relapse or come back after treatment, but not necessarily be there in a high enough amount for treatment to be needed. And the reason that we take that into consideration is because this is a disease that people can have for over 20 years. And so it's somewhat of a strategic plan where you want to treat when necessary. You don't want to over-treat, you don't want to under-treat. You have to have kind of the perfect balance and be really thoughtful about when treatment is needed. But for people that do need treatment for relapsed follicular lymphoma, similarly to the frontline setting, there's a lot of great things. So again, immunotherapy is making a huge splash. We have two types of treatments called bispecific antibodies that are new. We also have chemotherapy like we have in the first line setting, immunotherapy with rituximab, and then there's oral chemotherapy options. So for people whose disease relapses even more and more after that, there's other types of treatments called CAR T-cell therapy, which is a type of a transplant cellular therapy. So lots of options, including clinical trials, which are super important to think about if those are accessible to you. In the last year, there have been a few new approvals made in this space. We have so many new treatments for follicular lymphoma that we didn't have before, even just a couple of years ago. We have 3 cellular therapies, which are CAR T-cell therapies, and those are highly specialized types of treatments that are needed to be given in a specialized center. We have 2 new bispecific antibodies. We have 3 pill forms of chemotherapies. One of them is known as zanubrutinib. Another one is known as lenalidomide, and then another one is known as tazemetostat. All of those drugs are being combined together. They're being sequenced in a different way in clinical trials. So there are next generation of all of those treatments being studied as well. So there's a lot out there that is available for patients.